And then this is part 3, as I mentioned before. So if you haven't been on, don't worry. You can catch up. We are going to be uploading all 3 parts to our website. So please be on the lookout for that for anyone that you might have missed. But the first part was really to discuss, how is your center or your silk set up in order to prepare for this new community engagement, and really a discussion of what that used to look like. And then the last series we did, or last part of the series we did in June, and that was to really discuss what does that look like now? In the middle of a pandemic, how have we started defining what community engagement looks like now? It may not look like that in-person group that we're so used to. It may look a little bit more virtual and more engaging in different ways. And then we even had some stories of already that we were going to be doing a hybrid. And so some of you have already started to engage in that programming. Today, the original concept behind this is that we would be moving forward in the pandemic, and that we would all be moving towards hopefully getting back in the office, if that's what that looks like for you, and engaging with consumers in a new way, and having the option to be back in person. I don't know why the pandemic didn't read my thoughts, but some places we're seeing it spike again, and unfortunately we may be going backwards. But I still want to keep the focus on what we were going to be hopefully in within that mindset that I had so long ago, is what does that look like going forward? Because clearly it's not going away right now. So what does that look like for your center? What does this look like for your consumers? Community engagement used to look like going out into the community, spending time in physical locations around people. We know that has been redefined a little bit. We have so much online platforming, and we have so many other ways that we can engage with one another. I'm curious on what we've learned and all the things that we have covered in the last couple of months. Where does that leave your center? I want to talk too also about what are some areas that you are struggling with within some of that programming. Is it limited staff, or is it overwhelming staff time to commit to so much? Is it figuring out how to do a hybrid program if you do have some stuff back in person, but you're not sure how to engage those individuals online anymore? And if you have words of wisdom on all of that, we want to hear that too, so we can all as a community engage and also continue to grow and increase our outreach as well. So with that, this conversation is a conversation of you all. So you all are doing the work, you are putting in the time with the consumers. And so I want to hear from you. How is this going? What is everybody's plans? I guess we can start there. Where is everybody's plans right now on your programming, and how are you taking what you've learned in the last year or started implementing and increasing it, or are you getting rid of it or combining it with other areas? So I'm just going to open the floor. Where is everybody at?
I'm Shannon Porter. I'm with Empower Abilities in Springfield, Missouri. Our office has been virtual for over a year now because we've been the hotspot, from early on. And so we have moved all of our programs to virtual and seen some growth there because we have been able to expand our reach. People who wouldn't maybe have ability to come into the office have started joining some of our virtual programming. So I think we've seen that as been one of the side effects as a benefit for the organization. But one thing that we've seen as a challenge is those direct case management types of activities have really declined. People aren't interested in working on goals as much remotely if they can't come in and meet one-on-one with a independent living specialist. So our caseloads have really dropped significantly. We've kind of ramped up our virtual programming. So we've kind of seen a big shift there. I'm hoping that we can find a balance when post-COVID, where we're able to bring people into the office and work with them directly and get more of those one-on-one cases going, but still finding ways to stay available and accessible to people who are maybe farther out from our center and aren't able to come and join our live, programs and services.
Thank you for sharing that. Can you share a little bit more? You said you're increasing your programming. If it's not on those goals that they want to work on necessarily, what exactly are you putting your programming around right now?
Group activities. We have a program called Live and Thrive with a Disability. And we actually had started that a few years ago as a holistic wellness program. But that's one of the things that we've seen grow and become very successful as a virtual option, because we look at different types of wellness. And so bringing in guest speakers, especially guest speakers from far away, is fairly easy on Zoom. And so I think it's in that way, it's kind of expanded our opportunities. We don't have to bring speakers in from out of town, but we've actually seen our reach go beyond our service area. So we're seeing people join us from even outside of the state. So I think that's definitely a benefit. We want to try to maintain some of that, but we've also lost some people who aren't comfortable with Zoom. So trying to make those connections and retain those connections while we get through this. Hopefully we'll see them come back when we go live again.
Thank you for sharing.
You're welcome.
Did anybody have any questions for Shannon or anything you wanted to add on to that? No, and then this was what I was kind of hinting at the beginning, is Heather and Ashley both reference that it seems everything's going backwards. And as far as they were commenting in the chat that Kentucky is going backwards too. They just went virtual again and everybody hates it. So the Zoom overload that we feel is just kind of upping again. And then, oh, go ahead.
I think one of our biggest challenges has been trying to stay engaged with our youth, because they definitely have the Zoom overload, especially since schools were virtual, and they really aren't interested in maintaining a lot of that virtual contact outside of what they have to do. So I think that has been one area that we've really struggled to try to serve that population when we can't do it in person. I don't know if anybody else has had better success with engaging their youth virtually, but we have really seen that drop off significantly.
Hi, Shannon. This is Donna Gillette from upstate New York. Yes, there is life above the Hudson, and our center is located. We have our main center in Utica. I'm here as a director in Herkimer, and we also have an Amsterdam satellite office. And I had sent you a question just to you about. I was interested. You said something right at the very beginning when you introduced yourself that you were, doing remote presentations. So that question had to do with what topics are you finding were attracting participants. But when you, and I'd be interested in hearing about that. But the other thing was, I know that we have a really active youth services program across our centers, Utica being where our youth services staff are located, but they can remote to our offices or anywhere in the community. They actually put on their Life After High School event for the very first time through Zoom this year. And they actually had, I think, many school districts participating, and I think it was like 48 kids. So how they pull that off, I mean, how it goes when you're trying to get registrants for Zoom presentations and trying to make sure everything's set right. But we have not been serving face-to-face until this past 2 months now. We just went back. So we put in some pretty strict protocols. It's not walk-in. Our advocates have to set meetings by phone, ask questions beforehand, and we, tell them what to expect when they get to the door. And, they don't have face masks or other PPE. We have that here, but this is a struggle. I did a series of Ask the Advocate workshops in March and April, and that was the first time putting these on with me and my crew. And let me tell you, that was a riot, learning how to do all that. But what we found, we did extensive outreach, we had flyers and we connected with all the libraries. Police, officers just anyone that's a partner agency or we could think of that would have people interested. And we did 8 workshops half an hour every Tuesday in April, March and April. And we were lucky if besides internal staff that registered and participated, we got 2 or 3 community participants for each topic. So we're getting ready to do this again for mid-September through end of October. And I don't know, Sierra, it might have been you mentioning or somebody else bringing in guest speakers. And I know that when we brought in our Central New York Legal Services, we brought in an attorney to present on rent and the eviction moratorium. That attracted the most. So we're going to try again. We got some feedback saying, hey, this should be a little longer, but we didn't even get enough surveys back to. So it's this incremental little testing the water, see what works, see how you can improve. And it is a struggle. I think that our referrals have been increasing like immensely over the last 2 months, I would say. And so Sierra had also asked us about challenges. So my staffing levels way down. So as we start seeing the buildup of referrals and work coming up, well, you know what I'm doing with my supervisor, I'm pressing for more staff now, get some advocates back. So that's just a little update kind of on the subjects you've all talked on so far. But it's a struggle to try to figure out messaging, IL messaging, and picking topics that sound interesting and people want to hear about and are going to call you afterwards and say, I'd like to talk to you more about that. So thank you.
Sierra, this is Sarah in Texas. We're kind of on the same page as Shannon. We never got opened up again. We've all been working from home and delivering services from our homes for the last, year and a half. And we thought the area, we were fixing to get to open up again, but we are really being hit hard again by these numbers. So we're not looking to open for a while anyway. But one thing that's happened to us, we host this huge health fair every year. And of course, last year we did it, but it was just a drive-by. And amazingly, we had a lot of people that drove through for the information and to get the services. But we had already made big plans to open up and have it this last month in Palestine and then in Crockett as well. We've had to shut that down and rethink the whole thing. We're going back to, I guess, a drive-through. We're still working on it, but it's a little difficult to get these services to people.
Sarah, can I ask oh, I'm sorry.
Go ahead, Donna.
Can I ask a question, Sarah?
Sure.
What has been your independent living center's policy for staff vaccination? What safety protocols for staff have you put in place? And because what I'm thinking as you were talking, you're not opening, or you think you'll be going in reverse again. Why is that exactly? Because I know what worked well for us here. I mean, I have a small office, so every single one of us that was vaccinated. So we were able to open this office back up. We had, up until this point, we didn't have to mask when we were in our works areas, but we had to mask when walking to another's office, the kitchen. So we had some really strict protocols, and I also had to set up, office reopening protocols to start.
Yeah, I did too.
Oh, yes, start allowing folks to come in safely. So what happened that you're thinking you're going so much in reverse with service again?
Well, I mean, we'll be okay. When I say in reverse, I just mean I didn't get to do what I intended to do.
Yeah, that's true.
But you did bring up a very good concern, and I have been struggling with it. Yesterday, I was trying to write policy and come up with some issues, but it's about the staff. When we do all get back into the office, it's about the staff vaccinations. I
Right.
mean,
Okay.
we can't make them get vaccinated. I mean, what I would like to know what other people are doing in that respect. And the reason being, we had an incident this last 2 weeks. I was working in the office. My assistant was working in there, and then we had another staff in there. Well, 3 days later, she has COVID. I'm like, and well, I was fixing to get a vaccination. It's like fixing to get it, I'm like, so what can we do? What can we do about the staff that just refuse to get vaccinated? I mean, we have the protocols in place about the masks, social distancing, sanitizing, but I don't know. I don't feel comfortable, really, quite frankly.
Thank you for sharing that. I did want to just jump in. I know that Lene in Montana said that they should say we can ask, but they don't have to answer if they are vaccinated or not, because they are not allowed to ask if an employee is vaccinated. But I do want to circle back before we go down there, because I think y'all pulled out a lot of good pieces within that of the policies. I think when we're talking about programming, if you are already in person, or if you're wanting to eventually be back in person, who knows, do you have any policies that I know that surround your employees? I'm assuming you have something, hopefully. And then if not, have you included anything as far as your consumers coming in and what that could look like as far as that programming? But I don't want to ignore Jen. She's had her hand up. So go ahead, Jen. Oh, you're still muted.
That would be great to unmute. Okay, so I know in Eastern Montana here, we have called what are community management team meetings. And I don't know if you guys are interested in getting that started in your communities, but what those are team meetings between service providers, so they can share what they do, what they offer, and those type of things. And it actually helps with referrals to agencies. So when you're talking outreach, that's what I'm thinking there.
Can you say, what is the title of the group?
CMT, Community Management Teams. And we have different ones for different areas. I don't know what the western side of the state looks like, because we're a big state, but I know over here in Eastern Montana, there are a couple that I attend, and they cover different areas.
So for the community management teams, are those within your center, or are those people outside within the community as well?
People outside, like it might be your job service, child and family services, any agency that could be a resource, basically, for your consumers, or can refer consumers to you.
So I think that goes to trying to find everything. Shannon and Donna, kind of what you all were talking about is that participant piece. And even I know some people in the chat put in there of having people engaged, maybe that those new consumers potentially coming in. But Donna, I think that might even, and Jen, you can correct me if I'm wrong, that might even help with some of the direction of the programming. If the other community agencies are saying, we really need help with this, that could be where that center jumps in and fills in that gap. And now you have a whole audience to advertise to. Thank you for sharing that.
Absolutely.
I think too, this goes to trying again to figure out what our IL messaging is. There's so many things our agencies provide. And we get stuck in our own lingo, in our own, independent living skills training. And what the heck does that mean? To the general public, that could mean something very different than what we mean if we're talking IL. So the way we talk about our services and the way we try to connect it to the real life problems of individuals with disabilities So that when they see a flyer in the library or they get emailed to them, they're like, oh my God, yes, I'm dying to know about how an advocate can help me and what an advocate does. So we did one workshop just on that, and people, most folks are mesmerized by the extent of what we do. Because what we call it doesn't always translate well to everyone. Just a thought on that.
Anna, can I throw something in there? So the reason I thought about the CMT meetings is because yesterday I actually presented about our SIL on there and about what we do. And the people on the meeting, these are service providers that we interact with all the time. We're shocked at the amount of stuff that we offer. So to break it down into simple terms for them, really helps them to point people to our independent living centers.
Thank you for sharing that. That's good. And I would imagine, if you already have those partnerships within the community, you might not have that community management team, but that could be somewhere you can initiate and start that, be the center that starts it. So Heather, I know you've had your hand up. Go ahead.
Yeah, so my question, can y'all hear me? Because I think I just lost my connection.
Nope, we can hear you.
Okay, good. Sorry, there's a storm going on here. So if I lose y'all, I apologize. I think my question was for Sarah, the lady that spoke about the drive-through health fair. Did you guys offer COVID vaccines at that event?
We did have them scheduled for this year, and I'm sure we'll still be able to do those. It's going to have to all be outside. We usually offer on those health fairs anywhere from 20 to 25 free screenings. And we have so many people we're kind of a rural area. We have so many people that don't have insurance, and they don't get to the doctor like they should. I can't tell you how many people have just found out they were diabetics by coming to our health fair, and we were able to get them, the health care they needed. But anyway, yes, the answer to your question is we will have COVID shots.
Thank you.
That sounds like a really great program, Sarah, and much needed.
It's pretty big. It's a pretty big deal. The people we collaborate with call it the Cadillac of Health Fair. So that's a pretty good recommendation, I would think. So anyway.
What did you call your events? Can you say that again?
We've just had people that we excuse me, that we collaborate with say it's the Cadillac of health fairs.
I love that.
Kathy, I see your hands up as well.
I just was going to say a few things. We've been open since June. So, and I'm from New York. So when all of this started, Governor Cuomo was very clear with what he wanted to have happen the first time we were allowed to reopen. So our workstations are 6 feet apart. We put up a lot of glass partitions, even though now we found out that the virus doesn't spread that way. It's helped with colds and other things that do spread through, touching things. We have attestations for all of our staff every day that they sign. And when an individual comes in, they sign an attestation so that if we do have to do contact tracing, we know who has been in the building. Since we've been reopened, before we reopened, we asked just staff to let us know whether they were or weren't. We didn't ask them like a medical reason why they weren't. We just wanted to have an idea of what % of staff was going to get a vaccine. Most of our staff is vaccinated. In common areas, you do have to wear a mask. At your workstation, you're far enough away, supposedly, for the aerosols that you create on your own. When you go into somebody else's office, it's really up to you how comfortable you feel. A lot of our staff are friends and they feel comfortable. We've been very lucky. We've had 2 staff people get COVID, but they didn't get it from here and they didn't spread it to anybody here, which has been great. We do make individuals who come in, we ask them to wear a mask, but we don't get in an argument with anybody. They feel strongly that they don't want to, we still try to serve them. So, and we run a durable medical equipment loan closet, which is probably how most people know us, and in Ulster County, the county that we're in. And so we stopped taking some types of equipment. The way we sanitize the equipment is much more thorough, and we remind people to re-sanitize it when they get home, because we wanted to still be able to lend out the equipment, because, you know, just because we're having a pandemic doesn't mean that people haven't come up with a need and maybe don't have the insurance to cover it. And I think it's helped us look at a lot of things that we had been doing and how we've been doing it, and be a little bit more, I don't want to say serious about it, because of course we're running a business, so you're supposed to be serious about everything, but look at it differently and kind of tighten systems up. So we have 28 on staff. Most of our people can work remotely if they want to. The front end staff can't. I'm the chief operating officer, so I'm in almost every day. And so the office is never really crowded. So that's helped too.
Thank you. So it does sound like that loan program that you have is definitely still going through all of this.
Oh yeah. We had to shut it down for a while when the state was really tightly shut down. But we started asking people to set an appointment so that we could serve one person at a time. And then we found that that actually works better, because we would end up, when people just dropped in, having 5 people standing around waiting to borrow a wheelchair or a commode or whatever it was that they needed. So that's helped the front end staff manage their time, and it's helped us keep things a little bit more organized and straightened when the world rights itself again. We have the loan closet set up as a pre-vote station. We run pre-vote programs for OPWDD, and it gives participants an opportunity to learn some retail skills. So it's set up like a store, and we're trying to keep it look like a store, look nice and look welcoming, that somebody would want to go in there and you know, purchase something.
So do they have to apply online to make that appointment, or what's that process like? Because it sounds like what you adopted during a pandemic works well, and you might keep
Right.
that time thing, but how did they get into that? Is that in person or?
So somebody can email us, or they can call to set up an appointment. We have a lot of people call us to ask if we have anything that could help them, so you can reserve something. Right now we have a very fancy motorized wheelchair that'll do the tilt and stand. So we keep lists of people who are looking for items that, like I said, don't have the coverage to get one on their own. And then we try to set up and coordinate things so that they can get the piece of equipment to their house. We use Google calendars here. So we have a calendar set up for the loan closet that the front desk staff uses to coordinate. But if somebody came through the phone to me and they wanted to make an appointment to pick something up next Friday, I can click on that calendar and see if we have openings and schedule them from, you know, my desk. So that's been a big help. It's also been a help for us as people are starting to go back out in the field, to know who's going out when. Even though you're not seeing the person, they're working from home, you do know what their schedule is and what they've been working on. That helps me just ask the right questions when somebody comes in. You know, how did you feel going out in the field? How did the individual feel at a senior apartment? You know, what are the rules there? Or where, you know, did you run into any problems trying to get in to see somebody? So.
Thank you. And there was a question in the chat. Where are you working out of? If you could just repeat where that is again.
Kingston, New York. We're about an hour and a half north of New York City. So we have a lot of people in this area who who were impacted by the virus right away. When it hit New York City and a lot of people were dying, we have a lot of people who live up here that have connections to the city. So you don't find very many people who haven't been impacted by it. I think that's helped with vaccines and with people wearing masks and doing what's asked of them. But right now, our county has gone into the orange zone for the Delta variant, which of course, because we're so close to the city, that happens. There's a lot of people who have weekend places up here. We're in the Hudson Valley by the Hudson River and the Catskill Mountains. So it's a beautiful place to be in, close enough to the city that people who can afford it have second homes up here.
And Kathy, this is Donna again. We're also in that orange zone too. And it's really frustrating, but it's the reality, unfortunately. I think our ILCs have done just an amazing job at being able to keep providing services during this and figuring out very, very quickly how to switch gears and not let people down that need our services. So it sounds like everybody who's talked so far, I'd like to hear from some of the other folks in different parts of the country. I mean, you're hearing that we're in the orange zones, and in some cases, you know, we're seeing a lot of red across the nation too. So how are things going in your neck of the woods? Everyone else?
Yeah, so I'll send that out to everybody. If you also want to share, what programs what have you seen that's been a success? Like Kathy just shared that they changed up some of their protocol of how they are loaning or meeting with people to give out loans. Then how has that worked for you? Is there something that you've figured out did work and you want to keep it going? And then what does your programs look like? Feel free to jump in. And while we're all kind of figuring out if you want to jump in, I do want to circle back to that question. I don't want to leave Shannon hanging. I was actually trying to look through the chat or the participant list to see, are there any youth coordinators in here or anybody that works with their youth programming? How are you engaging young people during this and keeping them engaged? Because it is hard. They're on screens required all day. So are we, but when it's extra stuff, I know sometimes I don't want to join the extra stuff either, so I can relate. Can anybody give any feedback?
Hi, yes, I'm Jody Armstrong. I'm with Disability Achievement Center in Lago, Florida. And we have a very strong youth independent living skills group program. When we started operating virtually back a year ago, March, the young adults also went online, and it took a little bit to get them acclimated, but they all became very comfortable with that. So to the degree that the young women wanted their own group, so they have the full adult, young men and women together, and then on another day the girls meet separately and just talk girl things. Another thing that we did, and it was for isolation, we were very concerned about isolation, and we started online Tai Chi classes, and they are continuing every Monday. We did open up full service, full time back in May. Everything is pretty much back to normal, but we do have sanitizing protocols. We purchased what's called an eMist 360, and that is a hospital grade sanitizing, looks like a battery powered drill, and you can go around and within 15 minutes have the entire building sanitized. It's that quick, and it was very well worth it. We have hand sanitizer stations throughout the building. We have plexiglass barriers, so to enable clear communication. We have a very large deaf population we serve, so we want to make sure that people on both sides of that plexiglass feel comfortable, and we have 6 of those that people can just move around in front of them. But it has worked very well, and our young adults are very engaged.
I'm Kathy with a Center for Independent Living in rural Missouri. We are open. We just had our youth pre-employment transition camp last week. It wasn't a large group, but everybody, all the youth that participated except for one, was in person. We did the social distancing in the seating, and after the event was over, the youth that participated virtually was sorry that he did virtual. He wished he would have been in person, said that he would definitely be in person next year. For the state of Missouri, we have the Money Follows the Person program, and the state now requires that the monthly contacts with the MFP participants be in person. So we are doing that with precautions. And that's about all.
Awesome. Thank you.
Sierra, we're also getting ready. We did this last year too. And this is the last thing I'm going to say on this call, I promise y'all. But we're getting ready to do our youth transition conference that we've started about 13 years ago. And it's for youth that are transitioning from high school into adult living, independent living. We had to do it virtually last year. And I'll tell you, we were scared to death that it wouldn't work, but it did. And we're trying hard to get it to be even better this year. We usually have maybe between 125 and 150 to attend. That
Wow.
doesn't sound like a lot, but it is for our area. It's quite a bit. Anyway, that's what we're doing in the youth, and we have that monthly support group. But I can tell you, they are not happy about not meeting face to face, and I understand it, but they are attending. So anyway, that's our youth deal.
I will say that the youth that participated in our program last week, all of them voluntarily told us that they had received their vaccine.
Wow. Nice.
That's awesome. And no, Sarah, anything, if it's a 3-digit number, is a lot of young people. So there's programs happening with the youth leadership forums across the country that I think they maxed out at 60, some of them, and that's a lot. Very good. Awesome. And that's awesome, Kathy. Thank you for sharing that, because I think that, kind of going back to what we talked about a little bit earlier of vaccination within staff is a hard conversation, but then you start bringing in consumers not knowing, but if they are volunteering, and that's great that the young people are sharing that. And I did just want to point out too, though, I think what Jody had shared of they started one way, and then what do we do as ILs, right? We listen to what the consumer is needing and what they're wanting and create something that works for them. So I think splitting those groups up and kind of meeting that need sometimes is all that it takes to really find their niche and want to engage. They have to show up, of course, to share those in for that information. But I'm curious, I think it was you, Jody, you said you all were doing online Tai Chi. Are any of those groups, are you going to maintain those online or hybrid them, or what's the plan going forward for that?
Well, right now we're going to do the Tai Chi through the end of the year, and we're also doing food. Food was another issue, so we became part of the food bank. So both programs are till the end of the year. We are remaining flexible and able to move it forward if we want to beyond December. Everything's really, we just have to wait and see. They're in place, but we're ready to spring to a different direction should we need to.
Understandable. I think that's where we kind of all have to be now, whether we want to or not. Kind of Mark had said it in the chat, just being flexible has worked. I see. So Kathy, I think your hand was up, so I'll go to you.
I just, when Kathy was talking about the Money Follows the Person program, it's been hard because the nursing homes decide whether or not you come in and the state tells them. whether or not that's allowed. And then the individual or their family can also set restrictions. And unfortunately, some people, it leaves them in a position where they can't really communicate with the transition specialist. So our program just got money to purchase cell phones for those individuals to have access to while they're in the nursing home, and then for like a month or maybe two after they transition back into the community, while they're getting their own cell phone to have when they're living in their own home, which is going to be a great help to the transition specialists. They spend a lot of time calling social workers, waiting for them to call back. And it's as soon as you walk away from your desk, of course, that's when they return your calls. So hopefully everybody won't be so frustrated anymore.
Thank you for sharing that. I do want to highlight what you dropped into the chat, because genius. That is just a great idea. She said, we also created a space for working parents of school-age children to use for remote learning. It took a lot of stress off the parent trying to juggle full-time work and remote learning. The parents chipped in together to hire a person to oversee the children and help them with their work when they had a question. So, way to knock out one of the biggest issues that was happening, and some places still is happening, especially as we get ready to go back into the mainstream school calendars. All right, Jed, I see your hands up.
Thank you. My name is Jed Barton, and I'm the Outreach and Government Affairs Coordinator at LIFT. You've already heard from my colleague, Jen Hawkinson in Glendive, Montana. I'm at the LIFT office in Billings, Montana, about 170 miles up the Yellowstone River or down Highway 94 from Glendive. We here in Billings, which is a larger community, is the largest community in the state of Montana, about 110,000 people in town, 150,000 in Yellowstone County. We're slowly reopening. We have a sort of a room set up where our staff who needs to meet with consumers sign up for time to use that one specific room, and consumers meet their IL specialists there, and we sanitize and we wear masks and have the barriers and all of that stuff. It's so far it's been working okay. It's been from my own personal experience, it's a little convoluted because when you're having somebody in the office but not being able to take them to my workspace where my computer does what I want, for the most part does what I want it to when I want it to. I mean, it doesn't all the time, nobody's that lucky, but yeah, it's been neat to have people come in the office again. It's been, again, we've unlocked the door during working hours, so we've had a couple of walk-ins. Those are always interesting, to put it politely. We're on a very busy street, commercial street here at Billings, so it does help our foot traffic. We had an open house again, our Glendive office sort of opened in the middle of all of this, or reopened, if you know the history of our organization. And we were able to have an open house in Glendive. That would have been July 29th. And we're getting ready to have a sort of a picnic in the park with consumers and the disability community here in Billings on August 20th. Of course, that is pending. Everything appears to be okay right now. 10 days out, but so again, things are starting to trickle back towards, again, normal's not my favorite word in the world, but we're taking each day as it comes, and doing the best we can. Again, we have a enormous geographic service area of mostly rural counties. I did something for a project, and our square mileage for our service area slides us between Pennsylvania and Mississippi in terms of size, and the number of people we have outside of Yellowstone County is, I mean, makes it very interesting. But we've done the best we can. We continue to do so. It will be nice to visit some of those outlying communities again. I can't, Steve, you and I used to go to Columbus and Red Lodge all the time. It'd be nice to get up there, provided they're not on fire. That's another thing. We have the 170,000 acre forest fire, and that's just one of them in our service area today. So yeah, we're keeping on.
Thank you for sharing that, Jed. Sounds like y'all have kind of found some of what the pattern used to be, at least. So that's awesome. We have about 10 minutes left. What I would like to do is any takeaways. So this last over a year, looking almost at a year and a half now. What has a lesson or programmatic piece or policy piece or procedure piece that you've put in place that you are going to see going forward? Do you want to keep? I know Kathy shared one of theirs, and some others have shared. What does that look like? Whether you're virtual or in person or any of that, what's something that you would like to share that definitely you've learned or incorporated that you want to keep? Oh boy, I hope we've learned something. It's just going to be a long rest of this year.
What have we learned? I mean, it's done. Again, I want to pipe up and say, it's amazing what we can actually do when pressed against the walls. And it's been very helpful for me to be part of many of these types of nationwide listening and participation sessions and I'm hearing about the cool things that you all are doing. And I'm feverishly writing notes and trying to get emails and to follow up, because some of these things, boing, we don't all think of, like the parent group, facilitating that. And for parents who are like, I'm going to lose my mind, I'm working from home and my kid is there. It's just, I love that idea. And I love some of the other ideas. So this for me, these things will continue. And I think being able to really use the remote applications like Zoom and Meetup and all that, I think that's going to stay in my bag of helpful things. And we will continue with that. I'd like to hear more about how people are attracting new referrals that's working. I know someone in the beginning a couple people talked about referrals going down. And so I wanted to hear from any other agency staff, organization staff, where you're seeing the opposite and how you did that.
And while you're kind of thinking of the answer to what Donna has proposed, Steve, did you have your hand up? And then we'll.
Yeah, I work with Jed here at Living Independently for Today and Tomorrow in Billings, Montana. And in response to your point, Sierra, about is there anything we'd like to see continue to happen, is the soft reopening that we've had to make arrangements to meet face-to-face with people, but in a controlled environment, if you will. I would love to see that continue or to expand if the COVID Delta numbers would go the right way, because I spent several years here working as an independent living specialist, having face-to-face contact with consumers. And I just feel I'm doing a different job now, but I've just felt like this not being able to have that face-to-face contact with the consumers is just, it's almost like just talking to them on the phone. You know, when you can meet with them face-to-face, you really get a feel for, like, you get to know them, and you can help relate in terms of establishing goals and services and that kind of thing. And I kind of miss that just now because I am doing this different job that I don't work directly with consumers. But I really wish for the day to be soon where we could just totally reopen and reestablish that face-to-face contact.
Thank you for sharing. And I saw thumbs up and I saw shaking of heads. So I don't think you're alone. And unfortunately, I don't. We are, like many of you said today, I feel like we're kind of going reverse. Kathy, I did want to ask you real quick, and then I know some people have unmuted. Are y'all going to continue that parent group, or is that?
It's still there. It's still there. And even though school's not in place right now, we have somebody who has their 3 sons with her right now. So they have that space. There's art and craft stuff back there. I'm a grandma, but because of the virus, my son, who's a sound engineer for large events, and my daughter-in-law and their 3 children moved from California, and they live with me now. So I've been bringing my 3-year-old granddaughter to work, which has been interesting since I've been out of the parenting game for quite a while. But we have the flexibility to let that happen. And so we've been trying to be as flexible as we can be. And the parents have tried to really help, you know, because we've had to be more careful with the kitchen and with, you know, the water, what do you call it, where you get the water cooler. I'm losing my words. See, I told you I'm a grandma. To only use a 1-use cup one time, so we don't spread anything. So, but the parents have really, you know, even if they don't use it, I think it takes a lot of stress away that they know they could. So we're going to keep the option there. In New York right now, some of the school districts seem to be full speed ahead that they're going to open, and other school districts, the superintendents are starting to send emails to the parents saying, we're not sure what we're going to do yet. Our school doesn't start out here until after Labor Day. So
there's some districts, I think in New York State and elsewhere, that the district superintendents are requiring the children to come back with masks, and they're being sued or being threatened to be fired in some cases by higher ups. And it's really distressing to see all of the conflict around all of this, and it just makes matters more complex for us too. So I think we're going to be in a situation now that we're going back into these high numbers, and seeing more, you know, going back to more safety precautions, masking and social distancing. The need for all the wonderful services that you've all come up with during the pandemic are probably going to be needed for a while.
I would agree, unfortunately. Heather, did you have something? So that you had unmuted. Okay. I did want to just highlight, I hope that Pam has been dropping in such great stuff in here as well. They do kind of like a mental health check-in with people, phone calls for those that don't want to Zoom. And there's lots of virtual programs that are happening. And so thank you for sharing those in the chat. Oh, that's what Pam, I pulled it up as the suicide prevention and mental health packages that they deliver. So you all are doing wonderful things. I know that we're at end of the 3-part series. This has been really helpful, and I think to each other, but to me as well, to see how we are engaging with our community and continuing where IL started, right? Seeing what the need in the community is and meeting that. And who else better to do it than people within the community, whether it be your physical, geographic community or the disability community. So I think this has been great. again, this is not where I hoped that we would be when I planned this series. I was hoping that we would see the coming out of all of this, but as many of you have dropped in the chat and mentioned today, flexibility is key in all that we're doing. And I think we have been one of the most flexible organizations and agencies across the country to make sure that we're still meeting what everybody needs. And we're not just doing one area of need, right? We're meeting people socially, mentally, physically if need be, and equipment wise and health needs. And so you all are doing wonderful work. I thank you for that. And from this conversation, I want you to know I am going to go back to our April team and see what conversations we can maybe create just around vaccines and the hesitancy behind that. How do we operate? What are some of the best practices out there right now for staff and then consumers so that we can stay safe and that we're able to put some effective things in place so that we can all maintain that. I'm sorry that we didn't get to dive into that a little deeper. But I thank you all for spending time with us today. And like I said at the beginning, this was recorded. So please go back to our website soon and check it out if you haven't seen the other first 2 parts that might add to what you were already able to collect from today. And if you ever have any follow-up thoughts, please feel free to send them. We do have a COVID tab on our website that we are constantly adding stuff to. Some of the stuff that you dropped into the chat today, as far as your vaccine policies or employee policies, we'll probably put there as well so that you always have resources for that. We're trying to collect that as best we can and get that out to you. So feel free to check back there. Again, I just want to thank the University of Kansas and all that they've been able to provide for support for this to keep this conversation going. I know they are getting ready to do a several part series on community engagement as well. So make sure that you are hooked into our listserv because we are sending that out once that comes through. So it will just continue the conversation and dive in a little deeper. So thank you all for joining and I hope you all have a good afternoon.
Thanks so much, Sierra. This was a great discussion. Thank you.
Thank
Yeah.
you.
Thank you. Have a good day.
Bye-bye.
You too.